Hi, I am Dr. Felice Gersh, your integrative OBGYN physician. We are going to talk about a very important topic. It is not frivolous at all. It is the use of hormones to reestablish and maintain vaginal health. So the first things that we need to go over are like, what the heck is the vagina made of? What is going on with it? What does it do? I'm sure you have some ideas about that, but I may expand upon them. So we'll start with what the vagina is made out of. So the tissue that lines the vagina is actually squamous tissue. It's a type of modified skin. What makes it different from the skin on your arm? Well, it doesn't have the same like hair follicles, sweat glands. It's different in certain respects, but it is squamous tissue. And you may think, well, if there aren't glands in the vagina, how does the vagina stay moist? How is it that there's any lubrication in the vagina? Well, it happens through two processes. One is called transudation. That is that the serum that's in blood vessels that are feeding the vagina actually leak out the fluid, the serum, and it actually goes into the vagina, into the lumen, the opening area. So isn't that interesting? It's not secreted by a gland. It's through this process of coming out of the blood vessels and then entering into the vaginal lumen. In addition, the cervix makes mucus. I bet most of you knew that. And that mucus from the cervix goes downward. When you stand up or sitting down, it goes out of the cervix into the vagina, also adding moisture and lubrication. So through transudation and through cervical mucus, the vagina can stay moist and healthy. Well, what happens when you lose your vital life hormone, estradiol, when no longer is that being made by your ovaries? Well, none of these processes work properly. The cervix actually no longer adequately makes mucus, and this process of transudation also dramatically declines. So this is not good for the health of the lining of the squamous tissue. And of course, it makes having any sexual intercourse, sexual activity to become unhealthy and uncomfortable, okay? Because the vaginal tissues are unhealthy. So if you have intercourse that's rubbing, so the tissues are going to become more fragile, irritated, and injured. So we do not want that, of course, and it's unpleasant. It makes sex very undesirable. So we need to have estradiol just to maintain that moisture. But of course, it goes more deeply, literally and figuratively, than that. There are layers of tissue, just like there are layers in the skin. So you have underlying tissues, and in addition, so you have like the dermis that goes underneath the epidermis, and in addition, you have all the blood vessels that are supposed to be feeding the tissues, providing nutrients and oxygen. And then you have the other surrounding tissues. You have connective tissue. What do I mean by connective tissue? Like fascia. It's like an inner skin that keeps things together. And when you don't have enough estradiol, the entire thickness of the vagina will thin, will become less healthy, just like the skin on your face. Like if you look at an elderly woman, you know she's elderly by looking at her skin. It's like the transparency of aging is looking at the skin. So the vagina also becomes thinner, the layers become less healthy, and the connective tissue, like the fascia, becomes less healthy and actually can fray and become literally tear apart like an old piece of fabric that just frays if you pick it up and just like literally falls apart. Now, you don't literally fall apart, but the tissue actually can separate and not be healthy. So maybe you had a vaginal delivery or 2 or 3, whatever the number. Then what happens as time goes by, you may have had some injury to the tissue when that big baby came out through the vagina. And maybe it did do some damage to the surrounding supportive tissues like the fascia. And maybe it was a little bit frayed or torn from that. But then when you lose your estradiol, it's like it goes. It's like it was holding on and now it goes. So what can happen is that you can have prolapse. The census is dropping, and prolapse, it's really coming out of the bladder, which is at the anterior side, and the rectum, which is the posterior side, and even the uterus can drop down. So you can have prolapse and descensus of all of these pelvic organs into the vagina, and in severe cases, they actually protrude outside the body. You can actually see and feel a bulge. You can even see the cervix protruding outside the body, outside of the bottom of the vagina. That is not just due to aging. It's due to loss of estradiol. Of course, other things come into play, adequate nutrition and protein, especially as you get older. But the foundational thing is that estradiol. So we need to think of estradiol for maintaining the lubrication, the health of the skin of the vagina, and also the underlying and surrounding tissues that are supporting the other organs that are touching onto the vagina and keeping everything separated and lifted up in their correct positions. So this is like really important. So why am I bringing this up? Well, we're going to add more, and then you'll clearly know why. So what about the bladder? We know that after menopause, a very high percentage of women become colonized with pathogenic bacteria that are coming from inside the rectum and out onto the tissues of the perineum, and then those bacteria work their way into the vagina. And the microbiome, this collective of all these microbial life forms, become altered in a negative way. So what happens when you don't have the right moisture and the right health of the lining tissues is that you don't have the right microbiome, and instead you get the pathogenic bacteria moving in and taking hold, taking up residence. Well, it turns out, how do you get the right microbial population in the vagina? The large population of lactobacilli, which is the dominant, we'll call them the good commensals of the vagina, they require food. So where are they getting food? You don't put food up the vagina. Please don't do that. No food up the vagina. Okay, where do they get it from? The vaginal lining cells actually make it. It's like amazing. So they make glycogen, a type of starch, and they secrete this starch into the vagina, and it is fermented by the lactobacillus. In turn, the lactobacillus make lactic acid, and the lactic acid causes the proper pH of the vagina, which is acidic, like a pH of like 3.5 to 4.5, an acid environment, which is produced by the fermentation of the fiber products that are made by the lining cells, secreted into the lumen, and then you make lactic acid, which lowers the pH. But what happens when you don't have healthy lining cells? They don't secrete this fiber product, this starch, okay? So the lactobacilli die because they're starving to death. And in come the bad dudes, the bad microbes that come in that end up, when you have a bowel movement, you end up putting bacteria on your skin. It doesn't matter how clean you are. You're not sterilizing your bottom. So these bacteria can go right up in the vagina and take hold. And from in the vagina, they work their way up into the bladder. So this is a big deal because, as I was starting to say before, a very high percentage, like half of women who do not have any therapeutic modalities like hormones being given as a supplemental treatment, they will colonize not just their vagina, but their bladder with these bacteria that are coming from the colon, coming out from the anus, from the rectum, and then colonizing in the bladder. Now, colonization means they're just living there inappropriately, but they're not really causing active harm, that at least we know of. There's no symptoms. But of course, they can grow and create like inflammation and a true infection. So it can cross the line from colonization into infection. And then women will have symptoms like they have frequency, urgency, burning, like we call it dysuria. They get a cystitis, a bladder infection. And bladder infections are not only miserable, really uncomfortable, but it can actually rise and the bacteria can get in the kidneys, causing a pyelonephritis, an infection of the kidneys, and that's really terrible. That's a dangerous kind of infection and can even have the bacteria seep out into the bloodstream, causing what is called urosepsis, which can actually kill people. So we do not want to have this happen. So this is like a really important thing. And when you have adequate estrogen, not only do you maintain the vaginal health, but the bladder health. The bladder has receptors for estrogen, like no surprise, everything does. And when you have the right amount of estrogen and you get the right microbial population in the bladder tissues with the microbes make a protective mucus called the glycocalyx. The glycocalyx is the mucosal lining produced mucus that actually acts as a protectant of the bladder lining. Without that, the acidy urine, which is usually acid, will actually irritate and can even cause ulcerations in the bladder over time. So we definitely need to have our estrogen to maintain bladder health of the lining. And also distensibility. The bladder can stretch. It can hold so much urine and get so big. For that distensibility, you need estrogen to maintain that, because without estrogen, everything gets stiffer. So you will have a smaller bladder capacity, and then you have to go pee so much more often. So your bladder feels like you have to go so frequently, like you never had to go before. So we do not want that. All of that is definitely helped by providing estradiol in the perimenopause, when things start, because these symptoms can start early on as hormone levels are dropping, and for sure during the menopausal years. In addition, we now know that there's an interesting thing. A lot of people think women don't get cervical cancer once they're over whatever they think. I'm not sure what they think, but maybe like in their 50s. It turns out that there's a second spike of cervical cancer around age 65. Now, I've never seen a clear-cut explanation for why this is. Something like a quarter of all cervical cancers occur around age 65, and the mortality rate is substantially higher for women who have the cervical cancer when they're in their mid-60s. And a lot of doctors don't know this, that you can have cervical cancer in your 60s, and they tell women when they hit their late 50s or 60s, you're too old, you don't need it anymore. Not true. There is this spike. Now, cervical cancer is a very slow to develop cancer. It can take 10 years. It can take a long time. I've never seen a clear-cut explanation for that second spike. I don't think, but I don't know for sure, that I don't think it's due to women 10 years earlier, like in their early to mid 50s, suddenly having a lot of sex and getting sexually transmitted infections like HPV. I don't think that's what it is, but I can't prove it. But here's my theory. I think that loss of vital estrogen causes an impairment in the immune system and the microbiome of the vagina, and alteration of the cervical mucus production, which acts as a protectant also for the cervical cells, and they become irritated and more inflamed. And if you have HPV, human papillomavirus, present, it's more likely to, starting in the 50s, remember, cervical cancer takes about 10 years to develop. So if in the 50s, the early 50s, a woman is in menopause, then you would expect a decade later for there to be a diagnosis of cervical cancer. So I think estradiol is protecting against that second spike. However, without estradiol, you get that second spike. The earlier spike is in the 40s, by the way. What else do we know? We know that oral contraceptives, aka birth control pills, increase the risk of cervical cancer substantially depending on how long they're taken. And we know that, of course, the microbiome and the estrogens that are in birth control pills are not the same as what the ovaries make, not at all. Now, here's another interesting thing. How does it happen that the vagina can stretch to allow a baby, like a 9-pound baby or more even, to get out? You know, I always think of it like a snake. Have you ever seen a snake swallow a pig? And you think, what on earth? You know, you see the pig's outline in a snake. How can it happen? Well, like, we'll just think of the baby coming out as kind of like, how does this thing stretch? Well, it stretches because of estriol and also progesterone. So pregnancy is a very unique time. And it turns out that the dominant estrogen receptor of the vagina is the beta receptor. So just as a quick review, there are 3 types of receptors for estrogens: alpha, and there's more than one form of alpha, and there's beta, and then there's the G protein coupled receptor. And every organ has its own predominance of which type of receptor, but there are always some of each kind everywhere. And in the vagina, the dominant one is the beta. Estriol, the dominant estrogen made by the placenta during pregnancy, is 80% activates and binds to the beta receptor. So in pregnancy, you have this change of hormones, and you also have progesterone, which is like a muscle relaxant. Okay, that's why the uterus has muscle, right? The myometrium, and you don't want that to contract. Progesterone keeps it relaxed. Think of it as a muscle relaxant. So when you have these amazing hormones in pregnancy, you actually allow the transformation of the structure of the vagina to allow this incredible stretching to allow a baby to come out. If you put a baby, this is like magical, okay? You put a baby in the uterus of a woman who has the hormones of a typical 25-year-old, but she's not pregnant, say just a 25-year-old, and magically somehow this baby just appears. And then she goes into labor. This is all magical, and the baby's supposed to come out that 25-year-old's vagina who's never had exposure to the pregnancy hormones. That vagina would do what? It would rip and tear. It wouldn't stretch because it doesn't have that massive amount of estriol and progesterone. So why am I telling you this? Because in the menopause, this is one of the other places I mentioned before. You can put estriol on the face because the skin on the face is also dominant beta receptor. You need alpha everywhere, but if you're going to just target one thing, not the whole body, not trying to look at global health, just trying to do something good for the skin, whether it's on the face, the hands, or in the vagina, you can do great things with estriol. So that's from a compounding pharmacy. So in menopause, you can, or in perimenopause, you can get a prescription, obviously from your healthcare provider, from a compounding pharmacy for estriol. Okay, what about estradiol, the estrogen made by the ovaries? It's wonderful for the vagina, and most women use that. And I can tell you, in Europe, estriol is the most popular, but in the U.S., estradiol is the most popular. They both work beautifully. Because remember, a healthy 25-year-old who isn't pregnant has a perfectly healthy functional vagina if she has her normal cycles and everything. So she doesn't need help, she doesn't need supplements, and she doesn't need vaginal estriol because the estradiol does it all. It binds to every receptor, including the beta. It's just the vagina is not going to be so stretchy, but in menopause, it's totally fine to use estriol. It varies. Some women do better on estriol and some don't. In terms of estradiol, it does wonders. There are commercial products for estradiol that you can get from any kind of regular drugstore. You don't need a compounding pharmacy for vaginal estradiol. It comes in different forms. It comes as a cream, and some people think it's messy, but honestly, the cream disperses the best and it gets all into the nooks and crannies. So I think the estradiol cream when we use Estriol, it's as a cream, the creams work the best. But some people think it's messy. But even if someone thinks it's messy, I try to get them to at least start for the first few weeks on estradiol, because you can get like tablets. They're like suppositories, but they're kind of like tablety. And guess what? If you don't have any moisture in the vagina, which women who are postmenopausal don't have, I just explained all that to you, then guess what happens to those tablets? Nothing. They just sit in there. They don't dissolve. You could have a woman who has like 10 of those tablets in the vagina, like they're not even dissolving, because you need moisture. They won't dissolve. So even if someone says, I like the tablets better, I don't think they're as messy as the cream, because everything comes out where there's no exit strategy except out. So in the end, you're going to get better results if you start for the first, say, 6 weeks with the cream. And then if you don't like it and you want the tablets, you can switch to the tablets. The tablets are really small dose. So, for some women, it's just too small of a dose, which gets me to the topic of what about the systemic levels? The vaginal estrogen products are so low dosed that the amount that gets absorbed isn't going to be enough to actually do much of anything systemically. So if you're using standard dosing for vaginal tissue, you're not going to get much of any systemic level. If you use those products, you're not going to get systemic benefits. It's strictly for the pelvic area, but it's really great. Okay, so every woman should be using these products, whether she's sexually active or not, because it's not just about having a good sex life, although it can be about that. It's about having a healthy bladder, healthy tissues, and have the healthy surrounding tissues so your tissues don't all fall out and you have prolapse. That's a big industry. Also, that incorporates incontinence issues, because that is related to having like irritated bladders, small bladder capacity, infections that can create irritations, and also that the urethra coming out of the bladder just kind of goes into a downward instead of like up and then down. It just goes straight down, so that the urine in the bladder just like drains right out, and that's stress incontinence. And you can treat that with a little sling. But why have surgery if you can avoid it? Who wants to have repair surgery for prolapse? Let's be proactive. I'm all about prevention as much as possible. So we want to do that. Now, there's another type of product. Oh, one more thing I almost forgot to tell you. In addition to the cream and the suppository tablets, there's also a vaginal ring, not the one that's for systemic, but the one that's just for vaginal estrogen delivery. So there is a ring. The brand name is Estring, and it gives you vaginal estrogen for 90 days. Some people really like it. It's pretty pricey, not covered by many insurances, but it's nothing to leak out. So some people really like that the best. Totally fine with me if that's what you want. Now, what about DHEA? So that's the newer kid on the block. There's a commercial product called Intrinsa. That's like a tablet suppository. It's not my favorite, but it's okay. If I'm going to give DHEA, and I use a fair amount of that, I prefer it in a cream form from a compounding pharmacy. I think it really distributes better, it absorbs better, I think it works better. That's my opinion. And I think that it's very useful for women who have low sex drive. There's published data originated from research done in Quebec, Canada, that DHEA given vaginally will help improve more the full thickness, not just the top, but it's better even at doing the full thickness of the skin. It converts in the epithelial lining cells by virtue of the embedded in the vagina. There is the enzyme aromatase that convert DHEA, which is an adrenal androgen predominantly. A little bit comes from the ovary, naturally. This now we're giving as a pharmaceutical in a cream or tablet form. It's converted into estrogen in the vagina by action of the enzyme aromatase. And so what came out of the studies out of Canada, that vaginal DHEA can increase sex drive and sexual response to improve it. So for women who say, oh my gosh, I have no sex drive, or nothing feels like anything, I don't really feel any sensation, it's worth trying, no guarantees, worth trying, instead of using the vaginal estrogen products, to use vaginal DHEA. So we want to prevent bladder infections. We want to prevent prolapse. We want to make sex pleasant and keep it pleasant. We want to, hopefully, this is now hypothetical, lower the risk of cervical cancer. We have no data on how a healthy vagina with a healthy microbiome translates into uterine cancer or ovarian cancer. We don't know. All I can say is, why not have it best? The best vaginal health, the best vaginal microbiome. Why would we want anything suboptimally? Because who knows? Maybe it does have an impact on those cancers. And it's always better to be healthy. We also know, you've heard of leaky gut. You can actually have leaky vagina. So if you have the wrong microbes growing in the vagina and the lining of the vagina, the skin, the squamous is not healthy, and you can actually have separation, and you can actually have leakage of toxic chemicals, and the microbes and what they do, their fermentation products and such, go into the body proper. And potentially, this is not proven, but potentially, that I was talking to a very famous immunologist who said that he has research and believes that an unhealthy vagina can increase the risk of autoimmune diseases by the same ways that you can have leaky gut increase that. So there's so many reasons why we want a healthy vagina, even if you're not sexually active. So every woman who has not been on physiologic doses of estradiol should be getting vaginal hormonal therapy. Now, what if you're on physiologic dosing and your levels are very, very good, not super high? They're like physiologic. They're similar to what a healthy woman in her 20s would have. Many of those women do not need additional vaginal hormone therapy, just like a healthy 20-something doesn't need vaginal hormone therapy normally. That would not be usual at all. So if you have physiologic levels, then you probably don't need the vaginal hormone therapy. But if you're starting later, you already have vaginal, what we call genitourinary syndrome of the menopause, where you don't have healthy bladder, you don't have healthy vagina. Even if you go on systemic, you may want to go on vaginal hormone therapy as well, at least for a while you're getting your levels adjusted and so on. But that's sort of optional. But if you have really good levels in your bloodstream, you probably will have good levels in the vagina, and you may not need that extra vaginal treatment. But many women are not treated to physiologic levels. They're treated with very small levels, doses of estradiol. So those women will never have enough estrogen circulating to really optimize the health of their bladder or their vagina. So those women should really probably, I think they should be, on vaginal hormone therapy for the rest of their lives. Here's another really interesting point. You can start vaginal estrogen therapy at any age. You can start it at 60. You can start it at 70. You can start it at 90. Nobody is discouraging you. In fact, that is the standard of care, that you can start vaginal hormone therapy at any age. The vagina is important. It's not just about sex, although it is about sex, but it maintains the health and structures of the surrounding tissues. So it's really very incumbent upon you to tell your healthcare provider to prescribe you one of these vaginal hormone products. Thank you.